Yeah. So Mahesh sir needs absolutely no introduction. Is the director of Vittoretta Services at the Shankara Institute, and so he'll be speaking to us on the Ten Commandments. I think which most of the younger surgeons and the budding Vittoretta surgeons definitely need to know more and more about this. So I requested Mahesh sir to speak on this topic, and please, Mahesh sir, go ahead.
Thanks, Dr. Srinivas.
All pay heed. The Lord Jehovah has given unto you these 10 commandments for all to obey.
Good evening, everyone. I thank Dr. Chitra Ramurthy and Dr. Srinivas Joshi for this opportunity to meet you all this evening. We'll be speaking about 10 commandments for a successful VR surgeon in the next few minutes. Mastering vitreoretinal surgery is a slow and arduous process, and each case is different from the other. And we may be encountering cases as complicated as the one you see in the video, which is running for the first time in our life, and we'll be forced to take care of it. And during the fellowship, it's not possible to get a feel of such cases and just know about how to manage simpler patients. A budding VR surgeon has to hone his skills necessarily in the real world in a challenging environment. And some of these commandments will help us make this process a little bit easier. Looking at commandment number 1, we should be familiar with our instruments. Vitreoretinal surgery is heavily machine dependent. Optimal surgical outcome depends on efficient use of equipment, be it the microscope, vitrectomy machine, laser console. We should know the equipment's capabilities and limitations, which can result in optimal surgical outcome and also minimize the risk of complications. By thoroughly reading the manuals and discussing with the visiting technician from the company, one can have a good information and knowledge about the equipment, which will help us hone our surgical skills. Moving on to commandment number 2, similarly, we should know everything about the case which we are going to operate. In this patient, we are able to see all the fundus details. This patient has a proliferative retinopathy, and when we are able to see all the fundus details, that means the patient does not have posterior vitreous detachment. That would mean that there are multiple attachments and we'll need the use of scissors, forceps, cautery, and also probably a chandelier. So this planning is something which is particularly relevant and useful, and this will help us achieve the fastest route to surgical completion with thereby minimizing the complications as well. Moving on to commandment number 3, we should use all our senses in the OR. While we are focused on the surgery, our ears should be open. So we should be focused subconsciously on the steady beep of the pulse oximeter as well as the drone of the machine. When we hook the muscle, particularly the patient can be going for a bradycardia, and our anesthetist may be busy with the WhatsApp, and it may be us who picks up this bradycardia initially. Similarly, a patient who is probably wanting to micturate can be straining to hold on, and this can result in a tachycardia. And this is something which we can notice if we keep our ear glued to the pulse oximeter, because this patient, if he is going to strain, and that's going to result in increased blood pressure, and there can be suprachoroidal hemorrhage as well. Similarly, the drone of the machine will tell us if the machine is working properly or not as well. Moving on to commandment number 4, best is not to take shortcuts lest we lose our sleep. For instance, here we have a patient with a regmental retinal detachment. The membrane peeling should be adequate and appropriate, and silicone oil is not a substitute for adequate membrane peeling. Similarly, in a given patient where an encircling band is required, best is to place an encircling band so that we go home knowing that we have done the best for the patient. The patient may still develop a recurrent retinal detachment, but our conscience is clear and it's the disease which has played truant in that particular patient. Moving on to commandment number 5, best is not to bite more than we can chew in the early phase of a career. It's easy to misread the cases, post more complicated cases, post more than what we can handle, and then we become tired and mentally fatigued, which can have a deleterious effect on the subsequent cases which we're going to operate. So best is to plan the surgical day quite appropriately in consultation with a senior colleague if possible. Moving on to commandment number 6, it is not the equipment which gives the optimal surgical results. I often find youngsters asking for a particular vitrectomy machine, particular microscope, particular console. While good equipment may give us some leeway in achieving good results, it's ultimately the surgeon who gives us the surgical results. It's not the equipment. It's okay to operate with less optimal equipment. If we know these machines' capabilities and our own technical finesse, it's good to tailor them to suit the need of a particular patient. So it's okay to operate with a larger bore sclerotomy. Ultimately, the happiest people don't have the best of everything. They just make the best of everything they have. You shall have a long VR life provided you sit tight and right. It's best to look at a posture when we look at the microscope. When we sit in front of the microscope eyepiece should be at eye level, our back should be erect, the foot switches should be where they should be, patient should be positioned properly. So a fatigue-free surgeon assures a good surgical result and also a long VR life. Moving on to commandment number 8. We should take responsibility for our actions, and it's not a good idea to blame the patient or the disease for the adverse outcome. In my experience, I have seen two kinds of vitreoretinal surgeons. The first one is one who blames themselves for every failure in a surgery. This is good for their subsequent patients as they introspect, blame themselves, and try to get better the next time. On the other hand, blaming oneself results in angst, depression, and low self-worthiness, which can be deleterious to one's physical and mental health. The other kind tends to use the disease as a shield to cover their failures, and it's easy to do that in vitreoretinal surgery, and they are likely to stagnate, be plagued by poor surgical outcomes, and have to deal with unhappy patients. It is imperative to introspect every surgery, particularly those which did not go as per plan, revisiting their surgical videos, reliving them, and learn from it so as to get better the next time. That would be progress. So ultimately, it's better to strike a balance, accept when one is wrong, and acknowledge if the disease played truant. This is easier said than done, but then with practice and adequate introspection, one can walk this thin line, which will ultimately be beneficial for the doctor and the patient concerned. Moving on to commandment number 9, we should empathize with our patients. It is not a patient with TRD or with macular hole. It could be a one-eyed 40-year-old type 1 diabetic with a young family to support, or a young pregnant mother who has lost her vision suddenly, battling pregnancy on one hand and blindness on the other. Knowing this aspect of the patient helps understand their needs, apprehensions, expectations, prompting one to do the best for him or her, not treating the TRD or vitreous hemorrhage. As doctors, we start off being empathetic in early days, but routine blunts this so much that we fail to see the person behind the patient. And it is William Osler who said that the good physician treats the disease and the great physician treats the patient who has the disease. Now, commandment number 10, thou shalt remain humble. The moment we think that we are invincible as far as vitreoretinal surgery, we have a huge pitfall coming ahead of us. Not a good idea to have this I have learnt it all attitude. Being a doctor is being a student for life. Continued efforts at gathering knowledge is paramount to progress. The humility to accept the inadequacy of one's knowledge is important. Once one thinks that if all is learnt is the beginning of one's end. A humble VR surgeon is the hallmark of a learned VR surgeon. It is imperative to remain humble, enhancing one's knowledge, acknowledge their limitations, and constantly work on them to be a successful surgeon. Thank you very much for your kind attention.
Thank you very much, Dr. Kumar. We just needed you as the right person to give this wonderful talk. Very nice.
You have attributed my talk to Dr. Kumar.
Oh, sorry. No. Sorry. No, I'm sorry.
No issue at all.
But Mahesh sir, really a wonderful point. 10 commandments. I think all the fellows, I think, needs to go through this before they start their career or the fellowship. Also, one more point, sir, regarding most of the fellows says that, sir, I have got only 10 surgeries, I have got only 20 surgeries. But I keep telling them one point: learning a good dissection, membrane peeling, a good delamination is more important than doing 10 to 20 surgeries or 30 surgeries and then not doing anything literally properly. That they just, I always keep telling them, doing a vitrectomy is not putting the stirrer in the cup, try to stir it. There's a proper way. Even if given a simple vitrectomy, how to do it in a methodological way, I think that is more important than just just putting their probe in the vitreous and just cutting how they want it.
I agree 100% with Dr. Srinivas.
Yeah, Mahesh, just another point. I don't know whether your talk encompass that. It's also probably better to add 11th commandment, because you have to enhance your presentation from what it was when you first gave it. We can add that, the better or the best is often the enemy of the good, because many times you have to make do with a good result and not try to go for the best result. For example, if there is a small tissue there over the disc, which is essentially not going to cause much harm, attempting to peel off that one to give a spick and span anatomic result may cause intolerable hemorrhage in the eye. So some of these situations are probably best left alone. So try to achieve a good result and not necessarily go for the best result.
Yeah, I agree, Kumar. I started off with 15 commandments. I dropped the 5. So that's how we started with.
Mahesh, it's such a pleasure seeing both of you.
Add a 12th commandment
all-
is that when you have PG students, you have to tell them that patience is the mother of virtues, and patience is what is very much required when you're doing a VR surgery. They cannot hurry it up right in the beginning.
Yeah, thanks, Sarabhi.
Mahesh, such a pleasure seeing you here on this
Yeah,
forum.
thanks, Uttam. Same with you as well.
Pleasure.
Thank you,
That goes
Mahesh.
to
Wonderful